I'm going to demonstrate how to flush a central venous catheter or a central line. The patient that I am flushing their central line has a triple lumen non-tunneled catheter, and he has an IV running in one of his lumens, and I don't need to do anything with that, just leave it alone. But any lumens that are unused do need to be flushed with normal saline. I know at my facility that non-tunneled central lines get flushed with 10 mLs of normal saline every 12 hours, and I've already checked my MAR and know that it's time to do it. Because I'm working with the central line or with any IV, I need to use strict aseptic technique to prevent a bloodstream infection. The supplies that I need are a minimum of a 10 ml syringe of normal saline and some alcohol swabs. We want to use a minimum of 10 ml syringe because a smaller one would put too much pressure on the lumen inside the central line and could rupture it. So minimum of 10 mLs or larger. Some facilities have pre-filled normal saline flushes like what I have here, but however, if I don't have this available, I could fill up a 10 ml syringe with normal saline that does not have preservatives in it. If I were to do that, I would need to make sure and label the syringe before I left the med room, as any syringe needs to have a label. But my pre-filled syringe already does, so I'm ready to go. You want to make sure and let the hand gel completely dry on your hands for it to have full antiseptic effect. Hello, can you tell me your name and your birth date? John Brown, December 2nd, 1960. That matches his armband and the chart, and I want to check them at the same time he's telling me his name. Because normal saline in a central line is considered a med, I do need to check my 5 rights first. So I have the right patient, John Brown. I have the right drug, which is normal saline. The right dose is 10 mLs. The right time is now, and the right route is IV through his central line. So I need to get all the air out of my syringe. Even pre-filled syringes have air in them, and if I were to push any of that into his IV, I could cause an air embolism. So you want to make sure and get all the air out using aseptic technique. Okay, and I'm going to be using or flushing his distal port. So I unclamp it and scrub my hub for 15 seconds using my watch. If I were to time it in my head, I might not be cleaning it long enough, and that's important. I want to use vigorous friction on the top and on the sides, the threads. And then I need to let it dry completely. Again, for the full antiseptic effect, I need to let it dry for a minimum of 10 seconds. It may take as many as 30 seconds. And I don't want to blow on it or fan it or do anything like that. I want to check his site also before I start. I want to make sure that there's no redness, no swelling, that the dressing is dry and intact, that there's no pain. Does that hurt at all, Mr. Brown? No? Any tenderness? No? Okay, so that looks good, and my hub is dry. The first thing I need to do is push a little saline in so that I have room to pull back and aspirate with my syringe. I'm checking placement and I'm checking patency of the line. Then I need to pull back till I see bright red whole blood in the catheter. I don't want it to just be pink, and I see that. Now I want to flush with a vigorous push-pause technique to break up any fibrin in the lumen and get rid of any residue. And I'm finished with that. I can reclamp that lumen. Take my syringe off, and before I leave the room, I want to make sure and use hand gel or wash my hands again. And that's all.